So the first question is, I'm interested in the process for the health record app, how the information populated and kept up to date. My understanding of the app as it stands right now, and it's just started out, is that right now it is basically the information that's in the electronic record of the organization that it's coming from. So let's say it's Partners, one of the Partners hospitals in Boston. It would push out from the electronic record that's there information to your phone. Probably it's the same information that you could get on your portal. So if you have a portal that you can sign into at a hospital, that hospital determines what information is on that portal. So my guess would be, right now, most places are taking that same data that you get on a portal and they're pushing it out to the EHR that's on your phone. What makes this a little bit different than signing into a bunch of portals is A, you don't have to sign into a bunch of portals, B, all that information is in one place. So if you're somebody that has a lot of chronic health problems and you see multiple specialists, especially if you're also a care provider and trying to do that, you have a child that has multiple medical problems, you now have all that information in one place because it all is feeding into one location rather than having to sign into multiple portals. So that is one of the kind of exciting things. Is no time in history have we ever had information flowing from multiple places into one location for a consumer to have. My guess is that at some point you can put your own information in. I don't believe that's happening yet, but I think that that's the idea, is that you would have what they call consumer generated data. So you can put your own allergies in, your own medication lists and so forth. That's not usually how they start, but it's at least beginning. The app was only released, I don't know, 2 weeks ago, and I am shocked at how many other hospitals are signing up to do this since they released it. And I will say probably the biggest 7 in the country were the 7 that signed on with Apple initially, and then there's a lot of others that are signing on. And obviously, such an influential group as Apple, Partners, Geisinger, Intermountain, some of the big organizations, it's going to encourage other hospitals to do that as well. So, any questions about that?
I would say here in Portland, Intermed has a portal.
Yep.
And it's great because when you go for any care at all, you automatically have access to all your results, like immediately. It's wonderful from the consumer's standpoint.
From the consumer perspective, yeah. It's interesting, you know, not all that long ago, like 5 years ago, there was still this kind of staunch belief that, maybe 10 years ago, that the information was that of the healthcare provider. And the culture and the mindset around this has changed pretty dramatically. I mean, it's our information about us and our bodies and our healthcare. So, yeah, they may have that data in their system, but it's our information. You know, we should be able to know what that is. We should be able to interact with that. We should be able to advocate when that information isn't accurate. Lots of times when I was a nurse, I'd say, oh, let me review your allergy list, and I would list off that medication, the allergy list, or even medications, and people would say, I'm not allergic to that. Oh, okay. So if people had that information a little bit more readily, they could advocate to make sure that the information that are in these systems is accurate. So
I went to a doctor's appointment with my dad, who has dementia, and the doctor right then and there said, I'm going to dictate my progress note. And he did it like talking right to us as he was dictating it, and it was going right into the chart. It was pretty amazing, the voice dictation.
That's pretty cool. There's a thing called Open Notes, which most hospitals don't use yet, but when you go into your portal or the EHR, what you're mostly going to see is allergies, a list of your problem list, so your diagnoses that you've had in the past, your medications, maybe some blood work and all of that, but you don't typically see a note. But there's this movement to make open notes, and the VA has been the first to do that. And so basically what they're saying is whatever the doctor writes about the note is now viewable by the patient, which seems incredible that that wasn't always the case, or it shouldn't be the case. But for forever, physicians and care providers have been writing notes that were their opinion of the patient, and they didn't necessarily always want the patients to see that. Seems inconceivable to me to say that out loud now. You know, you should be this should be a partnership, not a, you know, be careful what you write in a note conversation, which is how it was. So the open notes is nice because then you can see exactly, you know, particularly if the information you're receiving from your provider is somewhat unsettling. Lots of times you get that information from your doctor. Oh, you know, you had this test and it was positive and I don't know what that means, we need to do more testing. Oh, how unsettling is that when you're sitting in there? You can go to that chart, you can read the open note, and you can see more details about what he said, maybe see the same thing he said, but you could share it with a spouse or a concerned, you know, family member and be able to process that a little bit more than just kind of hearing those words and then being done with that. So that's my advocation for engaging with your healthcare information. So the next question is, what are some of the cons of having online records? I think we covered many of those just now. I think other cons of having online records are if it's truly online and you can give that sign in to somebody else, let's say a child of an elderly parent, that's really helpful if the child lives away and they want to, you know, advocate for their parent who's having some healthcare problems. So being able to, there's usually a proxy process for having that access. So that's another one of the pros. The cons of having the online records, cons of having the, obviously I'm in the pro camp, so the cons would be probably privacy and security. So obviously I am pro online records, but I will say the cons are the security. And the truth of the matter is I think security has always been an issue. So the problem now is the big hacking scenarios that you hear about. So Medicare has a listing on its website of anytime information is inappropriately breached. It's called a breach list. So the majority of the time information is breached because providers lose their laptops and they have access to electronic health records on their laptops. And for the most part, they're encrypted. So chances are people aren't going to actually be able to get that information, but if they're stolen, if there's an iPad stolen or a laptop stolen, those are considered breaches. The other time that you have to report breaches is when somebody inappropriately accesses your chart. So if you are a patient, let's say the Bushes in the state of Maine, and they get their health care here in the state of Maine because they live here, people will look at those records out of curiosity that work at the hospital. So that's considered a breach as well. Of course, it's drastically against policy and those people should receive some type of consequence, and often I certainly participated in times where people were terminated for looking at those records. The other time that people look at records is when there's a crime. We had an infant that was involved in a murder. The infant was murdered and people definitely were curious about that. They looked at the records. So a couple people lost their job from that one too. So the truth of the matter is that while you hear these big awful stories, they don't happen very often. Very little information is usually actually breached, and the information that's breached usually is much smaller segments. You're hearing it sensationalized because that's what the media does. But I can tell you when you saw that slide of the paper records this morning, nobody was keeping track of who was looking at those records. So if you had access to that room, you could look at any record you wanted to. So the privacy issue, it is a little bit of apples and oranges, and I think we have to be buyer beware, but I think the advantages of having access to your health information and for providers to have access to your health information outweighs the risk of the privacy and security issues, so. Any other questions? What are your concerns about online records being hacked? I think we covered that one. So this question is, do you have any concerns about electronic healthcare information reaching insurance companies or life insurance companies and causing either loss of coverage or more expensive coverage? That's interesting because I haven't heard that concern in a while. I think that healthcare in general is going towards a system of quality rather than pay for performance. So most insurance companies right now still will pay for the majority of the care based on a visit. So there's that, right? But what they're going towards is a pay for quality. So they'll give a physician a certain amount of money to take care of a population of people with quality. So that means that Dr. Jones, all of your diabetics have A1Cs that are above this number. All of your diabetics have no foot ulcers. So insurance companies are switching their mentality from pay for service to quality. So what that says to me is that they're less worried about getting rid of people that have expensive issues. The pay.
More like a report card.
What's that?
More like a report.
More of a report card, right? So it's
A doctor that's actually having positive outcomes is getting paid better than the doctor down the road.
right, and that doctor is that's publicly reported. So people are going to be like, no, I'm going to go to this doctor because obviously they have that. It's a self-fulfilling cycle. They're going to go to that doctor, and so the doctors that are like, hogwash, I don't care about that, they're going to get less new patients, and maybe they're happy with that. But their report card will show that. And so insurance companies are kind of switching their mentality. So I see less of the concern about, I just got diagnosed with breast cancer. I don't want my insurance company my employer or my insurance company to know that because somehow that will be a negative situation. I see insurance companies as not particularly caring about those one-off expenses and looking at population payment control. Life insurance, I've just never seen, I've heard the concern, I've never seen it ever be anything that came to happen. So it's nothing I've ever worried about. I'm fascinated that I love to hear that people are concerned about their privacy, because to me, as a nurse in an emergency room, to me, I want to know what's going on because I want to help that person. So it's a different perspective to me, and I'm fascinated at how concerned people are about their privacy. I get immune to it, so it's great to hear this other kind of side about it. What kind of information can be analyzed? Is it more patient-centered or patient care-centered? I would say all of it. That's the fun part of it, in my mind, is that we're able to, with the electronic health records, we're able to analyze data that goes into it. And of course, when I say analyze it, we pull apart anything that connects it to the person. So it's not like this information is connected to a particular person. But now we can take that data, and that's really where we are now, is there's so much data, and we can finally do something with it. I mean, if you have let's talk about like the Medicare system. If you only have $5 million to take care of a certain population, you want to use that $5 million very carefully. So you're not going to spend it on something that isn't a problem in a particular area. You can focus that money to another area where that is a problem. So to me, the data lets you pinpoint where you need to provide interventions and change outcomes. So I think that's pretty cool. I think for doctors in particular, they can gather data of their whole practice and make decisions about the things that they do. Let's say you analyze the data of your 5-physician practice center, and you see that you have a really high rate of smokers, then maybe you need to offer more smoking cessation classes. If that's not a problem for you, then why spend the money on it? Why spend the time? Why do that? Focus the care and the education and the intervention on the problem that you have. The only way to know what the problem is, or the biggest problems, is to collect the data and analyze it. So it's patient-centered, but it's also population-centered, and that population can be 5 people, 10 people, 5 million people. So that's what's kind of cool about it, is that depending on how you aggregate the data, you can do a lot of different things with that. Does that answer the question, or any follow-up question? If you're watching online, don't forget you can ask questions on the Twitter feed. I'm going to check it right now. All right. Have you found that even when the healthcare provider knows how to use the software properly, it is more time consuming than the patient record? Yeah. So physicians, I've been involved in training physicians for about 15 years. And so there's a couple things that lead into this. As of the past year, physicians have finally said, this is ridiculous. I spend way too much time on my charting. I think they've averaged it an extra hour a day. And the other thing that is a little unsettling about that is oftentimes that extra hour a day is what they call pajama time. So it's like from 8 to 10 o'clock at night. So these physicians are catching up at the end of the day when they really should be unwinding and doing some self-care and trying to get themselves ready to go to sleep. So they come home, they do dinner, they do kids, they do all of that, and then they're logging back in at home to get caught up on their charting or whatever they need to do in the chart. So they're saying, you know, that's really causing a lot of detriment to our personal lives. So I would say that they're finally getting fed up enough to say this isn't any good. So my personal solution to this is twofold. Having done a lot of physician trainings, I think we have a long way to go on training properly. I think some companies do it better than others. I think that physicians don't always want to be trained, so they don't come with an open mind. So we need to do a better job of engaging them, in training them, following up in the training. So if they come to a classroom and they practice it, but they don't have to use it again for another month, having somebody with them that month later when they start using the system, helping them out, getting them going, giving them the tips of the trade, so that not only can they use it, but they can really use it. They get really comfortable. So I don't think we spend enough time properly training any care provider. If they go off and running, fine, they go off and running, but we need to be better about training everybody and not leaving them behind, because especially for those that never learned to type, this can be awful. Many of them use dictation, but that can be a little cumbersome if you don't know how to get the dictation going, depending on the system. So that is part of it. The other part of it is that I think now that most systems are in, most places have an EHR, the physicians are saying, okay, all these systems are focused on getting all this data, but it doesn't really work for my workflow. So a lot of them are saying, demanding that the EHRs change the way the systems are created. So what we call user design. Going back to the drawing board and creating systems that are more focused for the provider. So making it less arduous for them to do the note-taking that they need to do. So dictation is probably the easiest thing that they can be done. And if they can integrate it right into the system, they can simply talk or dictate like they always did, because they've always dictated notes, but dictate it into the system in a way that is not cumbersome. many of them are. So that's one way to help. Some places will hire a scribe. I'm not in the camp of hiring scribes, but a lot of places do that. They'll hire medical students to document in the EHR for physicians who really are not adept and never will be and have no interest in it. So they'll hire a scribe to do that for them. But I think we can change the design of the systems. There's a lot of new technology that's out that can minimize pick lists, predict what people are going to say so that it'll filter in. You have to always check it. That's the downside of predicting information. So you want to make sure that they double check it before they sign it, that type of thing. So I agree. I mean, I think we've come a long way with collecting data, but it's been sometimes at the expense, depending on the system, of time. And I think a lot of doctors feel resentful of that because they were promised this would be easier, and many things are easier, but many things aren't. I also think we forget how easy it is to get information now that we have these systems. So while we do have to spend more time doing it, you know, if you've ever been involved in a day where the computer system goes down, which doesn't happen all that often, but it does happen, you remember how much that system really does help you. Getting lab results, getting x-ray results. I mean, a hospital could come to a screeching halt when these systems go down. Again, it doesn't happen all that much often anymore. So that's the end of the question. Totally happy to take more questions. Totally happy if you guys want to be done, whatever you want to do. It's up to you. Kept it pretty fluid because I didn't know who was going to be here, how many people would be here, and what their interests were going to be. So, we have till 3. Yeah. So it's up to you. I'd say at this point, if I'll stay here for questions. Otherwise, you can stretch your legs until we wrap up at 3. Thank you for your time.
Great. See how the other groups are doing. I'm guessing it's towards the end of the day.
Yeah. Yeah.
So.
If you're following along at home, I think we're wrapping up our time here online. I still have the Twitter feed open and happy to answer any questions, but otherwise I think we're done.